You're looking at the Board of Health Committee. Separate from public health, it's comprised of city councillors and the mayor, a structure like many other municipalities. But there are concerns that the board doesn't represent Hamilton's diverse residents.
How do we best serve our community when it comes to healthcare? How do we ensure that Hamilton's voices, equitable voices, are at the table?
Lyndon George is a Hamilton resident and community advocate. He presented those questions to council today.
And what we see in other communities in Toronto and in Ottawa, there are community voices that are also in the room for helping to shape the discussion of healthcare.
Doctors like Cassia Johnson made their voices heard in favor of the idea. Many talked about the trust that needs to be built.
It's not our fault that we have biases, but when we miss the opportunity to make change, that is the true error in our ways.
Before switching to academia, Ruth Rodney was a registered nurse for 17 years at the General and St. Joe's. And Ruth shared her lived reality, from racist remarks from patients to other actions by staff.
Who has had pens and pencils stuck in my hair by colleagues because my hair is so cool.
She talked about her relief when another Black nurse began working in the ER.
Her presence meant that I didn't have to shoulder the sole responsibility of constantly responding to racism, and that someone else would understand how I felt.
Which is why Rodney says having diverse representation on this board will speak volumes.
It also gives the community greater confidence in the city when they see someone on the board who looks like them.
While the pandemic and vaccine hesitancy have highlighted the ways ethnic minorities are impacted and treated in the healthcare system, allies in the field believe a change is overdue.
Decisions are made with good intentions that are either ineffective or, in fact, sometimes harmful to the communities that they're intended to help.
Some city councillors are open to looking at a change.
It is time to consider it, very much so, especially as our city is growing, and particularly as it's growing in diversity.
This isn't about just jumping on a fad of making structural changes. This is actually about looking at this pandemic that we've just been walking through today, and that we're still going to be walking through in terms of the recovery, and taking what has been laid bare and saying, what can we do with this information?
It's the start of a conversation with the hope of creating an equitable committee. In June, Hamilton's medical officer of health will come back with some options and different models that are currently being used in municipalities across the province. And at that time, Hamilton's Board of Health will determine the next steps.